So this is a 15-year-old boy presenting with 8 days fall from bicycle, and he came walking with a flexion deformity. He had effusion and almost no clinical test could be performed on him. Lachman was very difficult to perform, and his collaterals were stable. So this was his X-ray. The X-ray shows a Seagun's fracture, that is anterolateral ligament avulsion, and obviously a comminuted ACL avulsion fragment that is widely displaced. The MRI didn't give lot of information other than an avulsed fragment. So the question in treating this case is, this is a displaced ACL avulsion with an immature skeleton with an open growth plate with a Seagun's fracture. Obviously this needs reduction and fixation, whether it is arthroscopic or open. Does anterolateral ligament avulsion need any special treatment, and what are the options when we do it arthroscopically, whether we use screws, staples or sutures, or what sort of suturing technique is used, that is a double bundle, single or multiple tunnels are used to fix this ACL avulsion. So can I start with Dr. Arora? What would you do for this?
I think, of course, the ACL avulsion must be fixed.
Yes.
And you can do it arthroscopic, and the anterolateral ligament, I think, should also be fixed.
Okay.
Should fix both.
So my choice would be an arthroscopy and repair of that ACL avulsion with the help of 2 suture tunnels on either side of the ACL avulsion fragment, medial and lateral. And after the end of the procedure, if the knee does have a rotational instability, then I'll go ahead and do an open fixation of the ALL avulsion with a suture anchor and not violating the physeal plate.
Yeah, in this case, if I'll see the X-rays or MRI, chunk is big enough, I would go ahead and fix it arthroscopic reduction and fixation with screws. And if, as Sachin said, there is a rotational instability over there, then I would do a ALL.
How do you avoid an epiphyseal plate? What precautions would you take to avoid?
For epiphyseal plate, now we are getting a bio screws also for that, and that we get in a smaller length available.
Okay.
For that.
In this case, basically ACL avulsion is a big chunk. It's better to fix with arthroscopic suture fixation technique, and of course the avulsion of Seagun, I mean ALL has to be fixed.
Okay. So I'll show what I've done. So this was a big ACL fragment. The crater was debrided. The anterior intermeniscal ligament was also debrided so that we get a good vision of the tunnel. I used 2 tunnels, one on either side of the crater, and I use smooth pins so that I do not really damage the epiphyseal plate. A suture passing device, this was expressive to get into ACL stump. I crisscrossed these fiber wires so that I get more wider coverage on the stump, on the bone fragment. The fragment was reduced. This is the sutures were tied over the bone tunnel. This is the immediate post-op. And this is followed by 3 months. Nothing was done to ALL. The ALL fragment appeared to have healed well, and the bone piece is in place. So thank you very much.